tell us what it means, just before you just in case?
Okay, so multidisciplinary is a group of different people from different professional backgrounds working together towards someone's care. Yeah. But yeah, 3 out of 4 people that we gave that card to talked about discipline. So they obviously think we go behind the scenes and start talking about how to actually get them to do things.
Maybe that's needed.
Yeah. Yeah. Human beings are very interesting creatures. There are some things that we lack insight in terms of our behaviour and how well we do at things. So we all think we're really good drivers. You ask a group of people who's a good driver, most people will say they're a really good driver. We all think we're really nice people, even Donald Trump. So Donald Trump has stood at podiums and said, I'm a nice guy. You know, we all think we're nice. And when you're a health professional or you work in the health system, we all think we're really good at delivering health information to our patients and to their family members. So it's a really difficult position that we're in when we're trying to help our staff understand issues of health literacy, because we're actually challenging their own notion of how good they are at something. And so that gets very complicated. And they think they're good at it because that's their aim, that's their intention. They actually want to do a good job. And so because they think that they want to do a good job, they think that then translates into actually doing a good job with information. But what we find is that the patient story and the staff story end up being quite different. So we decided to do this video because when we're thinking about how to actually help our staff understand this issue more, we realised that it was the patient experience that was going to be the selling point. It was going to be them telling their story that would actually help staff to understand what they needed to do differently. So we now show, it's a shortened version of this video in orientation, but as Lynn said, we've been showing it in a range of contexts with people. We thought what we'd do though is just try and figure out the impact of the video on staff. So we sent out an evaluation, and whenever you do that, you send out 50 or 100 evaluation forms and you get 15 or 20 back, which is exactly what happened. And so we didn't have a small sample, but they did say that it was a useful video and that they would consider going to additional training on health literacy after having watched it.
Sorry, was that to staff? That
was to staff. These were some of the quotes that they put on their feedback form to us, just saying that yes, they recognise that some of the stuff that was being said was very true and that we all needed to think about those things. But there was one thing that came very clearly out of the evaluation we did on this video. They all thought they did a really good job. It was everyone else. And in particular, they blamed the doctors. They saw this as a doctor issue. And so that has been really interesting for the members of the meeting to think about, because how do we now target it to make sure that everyone understands this is about everyone? We certainly didn't ask specifically about doctors. Certainly the people in the video talked a lot about doctors, but we didn't ask about that specifically. And we know it's the admin people and the operational staff and everyone in the organisation that contributes to this being such an issue. One of the stories that came through our health service was that one of our staff members was out talking to patients on the ward, and he said, "Oh, before you go, can I just ask you a question?" And she's like, "Yeah." And he said, "Every time the nurses come to the bedside to do handover, they say that I'm self-care." And he said, "I'm really sick. I could die. I've got heart problems." And he said, "What does that mean? Do they know that I'm sick?" And if you don't know, and I didn't know this before either, self-care is a nursing term that simply means that person can get to the bathroom and to the shower and can feed themselves. So he'd sat for days in this space of anxiety thinking the staff around him didn't really understand how sick he was, because he heard the word self-care and in his head that meant they didn't have to take care of him, he was good. Yeah. So health literacy is really about stories, and Lynn's going to share another couple of stories with you now. Oops.
As we've said, health staff think that they're communicating well with their patients or clients, and that they use basic language. But as you saw in the story that I told earlier, basic language can be misunderstood. People don't always understand that. Also, what people or health professionals don't always understand is that when a person is anxious, they don't always hear very well, and it's very easy to misinterpret information. And even simple words, or what we think as simple words, can be misunderstood. Two more illustrations. Oh, thank you very much. Two more illustrations. A patient was asked by a healthcare professional to turn round and walk towards a wall so that their gait could be checked. All the person heard was gait and checked. They turned round to the health professional with a confused look on their face and said, "Yes, I understand those instructions, but where's the gate I've got to check?" The simple thing to say would have been, "Can you walk over there so I can see how you're walking?" On another occasion, a person was asked by a health professional, "How's your diet?" The reply was, "I'm not on a diet, I just eat normal food." In this case, the health professional was really asking the person, "What do you eat? What's your nutrition like?" But having heard the word diet, the client thought that they were expecting them to be on some sort of diet for their health condition, and were very confused. So even when we use simple words, because of anxiety, because of levels of education, because of a hearing problem, our messages can be misunderstood. When you listen to these sort of stories, you understand the issues around health literacy and the need to communicate so that patients and their families have real knowledge and real information and understand what their healthcare is about.
So one of the things that came out of the video for us was that health literacy is about more than words. And when you listen to some of the things that some of those people said, and they used terms like a level playing field and, authoritarian figures, and that was the language that they were using. And so we have to remember that health literacy is also about power, and it's about making sure that we are actually being equals in the process of how care is delivered. It's about power of our time, and it's about power of our training. It's about power of the positions that we hold in healthcare, and it's also about the power of our language. So in order to do health literacy well, I think we need to understand that there's this power dynamic that still exists within health systems that we have to address. And obviously, with any large culture change, that's going to actually take time. This video isn't about changing the world, it was about planting seeds. And just to help understand that the issue exists, and to start questioning ourselves and questioning whether we're doing things well enough, and actually be open to training. So we see this video just as a very small part in a very long journey, and our aim is to do far more with patient stories when it comes to health literacy to help our staff understand. Health literacy forms the foundation for partnership in healthcare. And by extension, that means good healthcare. And that's the sort of care we want to receive as patients and as families, and it's the type of care we want to deliver as healthcare staff. So that's the end of our discussion. Are there any questions today?
I'd just like to ask, during your presentation and the research that you do with your staff, I haven't seen any commentary about people trying to access your service who come from non-English speaking backgrounds.
Yeah.
Could you repeat the question, please?
Sorry. She was asking, there's no commentary about people trying to access the service from non-English speaking backgrounds. That's certainly on our radar to have more discussions around that, and we know it's an issue. In fact, we hear some stories about people even just struggling with signage in our hospital because of language issues, and so that's certainly something that we want to consider as we move forward.
Are there any final questions? Oh, we've got two more. So we'll just take these two and then we'll have to move on.
Okay.
So,
Another idea that came to me while you were speaking is the use of acronyms.
Yes,
Yeah.
absolutely.
Well, actually, it's sort of like a gatekeeper system, isn't it?
Yeah, it is.
They function to keep people out.
And actually, and even when we have consumers come into the meetings, that's one of the things we always discuss with the chairs of the meeting, and we have a list of acronyms because it does divide people. It sets a barrier in place for people understanding.
I'm a carer rep for
Yeah.
various organisations, and the issue of jargon, especially in hospital committees.
Yeah.
It's a challenge, and so that's something we talk about.
I just have a very quick story around acronyms. It was a handover. The patient had a significant brain injury. Their mum was sitting with them during handover, and the nurse said, "Oh, her GCS is 15." Now, the mum freaked. Now, a Glasgow coma scale, 15's the best you can get. But hearing 15 and hearing an acronym that she didn't know, mum just absolutely freaked. So, yeah.
okay, is it Kevin? Yeah.
Just taking up about English speaking, there's another side of that as well, and that's cultural norms within those groups.
Yeah.
So, like you'll find some of the Middle East and even some Aboriginal group clans where, you know, if it's a care issue, they'll only listen to either a male or a female. But, you know, if the instruction comes from the other sex, then they're not willing to take it into account.
Community and law is what you're referring to.
Okay.
Thank you. And another sort of problem is that we really don't have a good communication system between the hospital and the normal community health provider.
Yeah.
And the number of people I've seen bounce back to hospital because the hospital's changed their medication, they go back to their GP, the GP just writes them out scripts for the old medication. They take those, there's contradiction, back into hospital. And I didn't see people.
Yeah. Look, I think for me, all of those issues highlight the incredible importance of the consumer partnership work that we do, to have people in the spaces with those staff members saying those things, and have people prepared to be videoed and telling their stories, because that's the stuff that actually changes staff's mind about things, because otherwise they tend to think, you know, as we often do, that things are fine. If people aren't complaining, things are fine, and we know that that's not the case. And so, you know, the very essence of having consumers embedded in a health service, I think, begins to address that and begins to make sure that at every level we're asking those questions. Yeah, thank you.
I think there were a couple of people who didn't understand or didn't hear Kevin's comments, and his comments were an attempt to pick up on a point that was made earlier about people from non-English speaking backgrounds or people who are from culturally and linguistically diverse backgrounds. And part of the point was it's not just the language, it's also questions of culture and who speaks on what issue, who will be heard when they speak on what issue, and that both those things need to be taken into consideration. So I'm going to have to call it to an end now. For those of you who have more questions, I'm quite sure that our wonderful speakers will be able to talk with you over lunch. Thank you all for listening. Can you join me in thanking our speakers for their presentation?